Dr. Michael Holick is a pioneering physician scientist and one of the world's leading experts on vitamin D, whose decades of research have helped shape modern understanding of vitamin D metabolism, deficiency, and its impact on human health. As professor of medicine, pharmacology, physiology, biophysics, and molecular medicine at Boston University School of Medicine, Dr. Holick has authored more than 900 scientific publications and has been actively involved in the development and discussion of vitamin D guidelines and public health recommendations over the course of his career. Welcome, Dr. Holick.
Thank you so much for that kind introduction, Jen. So I'm going to give you a very broad overview of the 2010 IOM guidelines, the 2011 and 2024 Endocrine Society guidelines, history and shortcomings, and a 2026 perspective. People worry about conflicts of interest, and so I do consult and speak, and I also get support from NIH. Now, you might think I'm an idiot because what am I going to tell you about vitamin D that you don't already know about from the Institute of Medicine report and the 2024 guidelines? And it turns out that the Institute of Medicine in 2010, they realized something, that the 200 units a day was inadequate, and they recommended 600 units a day. So the RDA was increased threefold. They also realized that 2,000 units a day isn't toxic, and they've recommended the upper limit can now be 4,000 units a day. That's amazing when you think about this. I'm constantly asked, what do I think about this? And I have only one word for it. Wow, right? Because no nutrient has been increased by that amount in such a short period of time. The question is, did they get it right? In 2011, the Endocrine Society practice guidelines, I was fortunate to chair that committee. All the members are experts in the field of vitamin D. And it turns out that the guidelines were specifically for prevention treatment of vitamin D deficiency. The IOM guidelines was not intended for physicians. It was recommended that professional associations should make those guidelines for patient care. And they used a population model, not a medical model. So the recommendation in 2011 from Endocrine Society, 400 to 1,000 units for neonates, 600 to 1,000 for children, and adults, 1,500 to 2,000 units a day. And if you're obese, 2 to 3 times more. Safe upper limit, based on the literature, 2,000 units for infants, 4,000 units for children, 10,000 units for teenagers and adults. 2024 guidelines, you need to understand that those guidelines were not for patient care. They were guidelines for those that were vitamin D sufficient and could take additional vitamin D for having other health benefits. But a priori decision that they made, they said that generally the population is healthy, and therefore the RDA should be the IOM recommendations, which is 600 units a day for most children and adults. Therefore, the 2024 guidelines assume a healthy population that's vitamin D sufficient. And what do they recommend? 1 to 18 years, 600 units a day. 18 to 70, 600 units a day. 75 and plus 900 units a day. Obesity, they don't recommend anything. And they don't recommend anything for the first year of life. Again, 2011 guidelines for infants and for children and for adults and obesity all were recommended. Is vitamin D deficiency a health issue? It's estimated 40% of the world's population is deficient, 60% insufficient. Here, a National Health Survey data from U.S. population showed less than 50% of the U.S. population is vitamin D sufficient, and some in the ages of 10 up to 30, no more than about 30% are sufficient. Recommendation 12 from the 2024 guidelines. Healthy adults, we suggest against routine screening for vitamin D status. So why should you care? Well, it turns out that vitamin D is important for pregnancy, and we showed with Lisa Bodner many years ago, the higher the 25-hydroxy-D in pregnancy, lower is the risk for preeclampsia. A very nice study looking at gestational age and 25-hydroxy-D, 60% reduction in premature births if your blood level is greater than 40 nanograms per ml. Mom, thanks for taking your vitamin D. Recommendation 8 from the 2024 guidelines. We suggest empiric vitamin D supplementation during pregnancy, given the potential lower risk of preeclampsia, intrauterine mortality, preterm birth, small for gestational age. That's fantastic. And they recommend 2,500 units of vitamin D a day. However, again, go back to the a priori decision. The panel said healthy population. And so even pregnant women, they recommend 600 units of vitamin D a day. 2024 guidelines, pregnancy, 600 units a day, even though they appreciated from the literature that a higher dose will markedly improve birth outcomes. Obesity is associated with vitamin D deficiency. The higher your BMI, lower is your vitamin D status. And so a study was done by Ekwaru many years ago. And what he did was he looked at serum concentrations of 25-hydroxy-D and how much vitamin D they were taking, and to see what would happen if you're normal weight, underweight, and obese. And he showed very nicely to get to the same level as a normal person, you would need to take 2.5 times more vitamin D to satisfy an obese person's requirement. They need 2 to 3 times more. Recommendation 14 from 2024 guidelines, they say adults, we suggest against routine screening for 25-hydroxy vitamin D, especially with obesity. The guidelines recommend obesity. They don't have any recommendation for obesity. IOM had used this study as a way of defining vitamin D status for bone health. And the Endocrine Society looked at the study as well and talk about another error in calculation. This is 675 German adults, ages 20 to 90 years of age, and bone biopsies and blood was taken. And the authors concluded to see no evidence of vitamin D deficiency bone disease, you needed to be greater than 30 nanograms per ml. And in fact, the Institute of Medicine said, wait a second, not really, because if you take the number between 21 and 29 for those that have osteomalacia, over all that are deficient or insufficient, only about 1% have bone disease. So that's no consequence, right? But the problem is they made an error, right? Typically, when you're going to do a analysis, you want to have this as your numerator and this is your denominator, 21 to 29. And if you do that, 22% of otherwise healthy German adults were found to be vitamin D deficient in the sense that they had osteomalacia, bone disease. None had greater than 30 nanograms per ml. And that's why the Endocrine Society in 2011 recommended 30 should be your minimum, 40 to 60 is preferred, especially because of the vagaries of the assays that were out there. Up to 100 is perfectly safe. Also, working with Bob Heaney many years ago, we showed 10,000 units of vitamin D a day to healthy adults is safe. And also a nice study again by Ekwaru showed 4,000 to 5,000 units a day, blood level around 40, 20,000 units a day, about 60. In 22,000 observations, no toxicity. What about COVID? When COVID hit, because vitamin D does play a role in your immune system, I worked with Quest Diagnostics, looked at over 190,000 patient samples. And what did we find? We found that if you were vitamin D sufficient, 25-hydroxy-D of at least 34 nanograms per ml, 54% likelihood of having COVID. We also look at our hospital and we're shocked to find if you walk in the hospital vitamin D sufficient, overall decreased odds of death was 67%. Overall odds of death ratio 82% if you were sufficient and you had normal weight. Recommendation 1 from the 2024 guidelines, they say that empiric supplementation for children can potentially help in reducing risk of respiratory tract infections. Right? And they said about 1,200 units a day, which is fantastic, except that they don't make any recommendations for children or adults to increase your vitamin D intake for anything. They just say 600 units a day. Vitamin D supplementation and diabetes, a paper came out, the D2D study originally said doesn't work. However, when you do and look at the data more carefully, And you look at those that had a blood level of at least 50 nanograms per ml compared to 20 to 29 nanograms per ml. They had a 76% with a 3-year absolute risk reduction from prediabetes to diabetes, which is truly remarkable. CDC estimates that more than about 50% of the US population has either prediabetes or diabetes. Recommendation 10 from, again, the 24 guidelines. Adults with high risk of prediabetes, in addition to lifestyle modification, they recognize 3,500 units a day can help. But again, what do they say? They assume that it's a healthy population, and they make no recommendations for adults that are obese or have prediabetes. Also, vitamin D supplementation and mortality. Here, a study showed 25% reduced risk. Cedric Garland showed very nicely the higher your 25-hydroxy-D, lower is your risk for mortality. What is recommendation 6 from the 24 guidelines? If you're age 75 and older, they automatically now say, don't take just 600, but 900 units of vitamin D a day, because that is going to help your survival rate. Your survival is based on everything that you've done as a child, young adult, middle-aged, and older adult. Not all of a sudden taking some vitamin D is going to make a difference for your mortality, right? They recommend 75 plus and over 900 units a day. Age-adjusted studies, again, look at this. This is Garland's data, 40 to 50 nanograms per ml, maximum benefit. You would have to take 4,000 to 5,000 units a day to achieve that level. And a study done many years ago by Walda showed that these hunter-gatherers have blood levels of 40 to 50 nanograms per ml. And they would need to take, like I said, you would 4,000 to 5,000 units a day. Vitamin D deficiency is a disease of neglect. Don't think about a normal level, but a healthy level, right? How much vitamin D do you need? We know, based on studies we did with Bob Heaney, you need 100 units will raise your blood level by about 0.6 to 1 nanogram per ml. If you're not taking a supplement, your levels are in this range. So you think you can get it from your diet. There's essentially no vitamin D in your diet. You cannot get it from your diet. Right? We did a study in healthy adults in Boston at the end of the winter, 1,000 units a day. Essentially, no one was vitamin D sufficient. I recommend minimum 2,000 units for adults, children, 1,000 units a day. Again, looking at the Aguaro study, 5,000 units a day for a normal weight person, 50 nanograms per ml. 10,000 units a day gets up to about 60 nanograms per ml. And if you're obese, you need 2 to 3 times more. Right? I was asked to review the 2024 guidelines and pointed out there's a mountain of evidence linking vitamin D deficiency with increased risk for cancer, mortality, autoimmune diseases, etc., and showed that essentially all of these chronic illnesses can definitely be improved risk if your level is at least 30 and sometimes 40 to 60 nanograms per ml. Adequate vitamin D is critically important from birth until death. Vitamin D can help improve your health. And I thank you for your attention.
Here comes the sun.
Thank you. That was fantastic as always. I love how animated you are, Dr. Holick.